Hi, I'm Russ Hornstein. I'm a chiropractor and neurologist, and I've created this technique called adjusting to neutral. So I want to take a few minutes and explain what it is, how it works, and why we would want to use this technique. So what it is really just what it says on the box. We're taking the joint and we're adjusting it back to a neutral position. Now we're all very well versed in seeing where joints are out of a neutral position. And neutral is important because the neutral position is the most stable position of the spine. And when we see subluxations that are holding the joint in one position or another, really what we're seeing is the joint's kind of stuck and unable to get back to a neutral and stable position. So we're taking a different approach here, and I'm going to teach you how to assess every individual joint and which vector it's been subluxated in. And when we can understand which vector it's subluxated in, we're going to put the joint in that position, and we're going to feel if there's resistance of the joint coming back to a neutral position. And if there is, at that individual joint in that precise vector, I'm going to show you the technique to drive that joint back to a neutral position. And in doing so, we do still have a cavitation, very interestingly. We have a big release of muscle tension, but because we're going in a vector which is specific to that precise resistance coming back to neutral, we can be very, very effective at only stretching the muscles that are holding the joint in that subluxated position, and we're not involving any of the joints or any other muscles. So the benefit is we're not stretching anything that doesn't need to be stretched. We're not taking the joint to the end range. So it's very, very comfortable. And because it's so precise, we see that the results last for quite a long time. In many cases, we just don't see them come back. Another advantage is that because these intrinsic muscles that we're focusing on here have such an important role in stabilization of the spine, that when we resolve these imbalances of the stabilizing muscles, we actually resolve the instability of the spine as well. So if we can reduce the tension of muscles that are holding the joint in a subluxated position, then we can get them to relax, and then the muscles which are opposite, which could have been switched off, will now start to work more effectively, and we create a balance of those stabilizing muscles. So rather than the joints just feeling loose after an adjustment, we're actually feeling the joints more stable. It doesn't mean that they're loose, it just means that they're actually being held together properly. We'll still be able to move, and in many cases, and actually in every case, you'll see the joints moving better because the biomechanics of the joint will be improved. It's those intrinsic muscles that are creating the tension and tone and control of those muscles are what are controlling the biomechanical function. So if we have an imbalance of the intrinsics, we'll also see that biomechanics have been compromised. So not only do we improve that particular subluxation and improve the stability in that joint, we're also improving the biomechanics of the joint. So that's the focus of this first seminar, this first technique seminar, is we're going to be looking at the biomechanics. I'm going to teach you everything about the details about translation and rotation in these joints, and you're going to be able to palpate and to be able to accurately describe exactly what type of subluxation you're feeling at every joint. And then I'm going to give you very, very precise tools with this technique to be able to adjust the cervical and lumbar spine with this adjusting to neutral technique. And if you're used to any sort of high velocity, low amplitude adjusting, if you do diversified or you do Gonstead, it would be very, very easy to translate your skills and apply them into adjusting to neutral. So this is a very, very easy technique to learn, very easy technique to incorporate. The challenge is really just understanding what it is we're doing with the joints. And so we're focusing a lot on biomechanics. And once we understand that, then everything falls into place very easily. So again, another benefit of it is because we're resolving that instability and those biomechanics, a lot of the compensation muscle tensions that would have come about as a result of instability or poor biomechanical function will also resolve as well. So we're going to go into other techniques and other ways that we can help to facilitate the release of those extrinsic muscle tensions. So if someone has shoulder pain, a shoulder tension in their traps or levator scapulae, or if they have erector spinae tensions in their lumbar spine, we'll see all those things resolve after the treatment, and I can give you some other tips and tools for clearing all of that tension. So you're going to be able to leave your patients more stable with better biomechanics and with less tension of those intrinsic muscles. So I hope you have an opportunity to join us in the seminar, and if you have any questions or comments, please just find a way to send them across to me, and I'll be glad to address them. And hope to see you in Netherlands soon.